morning, my name's Dewi, a Service Director for the Community Care Collaborative up in Wrexham. Today I want to share with you our findings from a 6-month impact assessment that we did pre and post the introduction of the emotional wellbeing team to 3 GP surgeries in Wrexham. We have been operational for just over 12 months now. Like I said, we took over 3 surgeries, about 18,000 people that we look after. What we had was a GP shortage, so we had to think creatively and innovatively about how we were going to provide good quality care for our people. We therefore sacrificed 2 whole-time equivalent GPs and we recruited 7 members for the emotional wellbeing team. And if I just move on, I'll show you a few members of the team. That's myself on the far right, Debbie, Nikki, Lewis and Paul. And what we are is a MDT team of mental health nurses, social workers and specialist navigators. Like I said, we sacrificed 2 GPs, whole-time equivalents, and we were able to afford, from a business point of view, 7 highly experienced members for the emotional wellbeing team. Our backgrounds are varied, working as team managers within community mental health teams, home treatment team practitioners, working within children's services, acute services, prison services. So the wealth of experience and knowledge that we were able to gather from making that change to a traditional model of delivering GP practice. And as we go through the presentation, I think the outcomes have been quite fantastic, really, in what we've been able to deliver over the last 12 months. So what do we do that's different to what a GP will do? Well, for starters, we've got 7 pairs of hands as opposed to 2. And given our experience and skills, we've been able to deliver group work. We've done a lot with bereavements. It's been ideal through COVID. We've done a lot of isolation work. Anxiety management is something we do daily. We've got members of the team who've been upskilled over the last few years. They can deliver CBT, short-term intervention. It's alleviated the need to refer into the community mental health team. Crisis has been something that we're very comfortable in managing, whereas GPs are quite open about the fact that they haven't got the time to manage crisis in mental health when somebody's going through a mental illness or a crisis. We offer longer capacity is naturally increased by having more members of the team. And we've seen some patterns during the last 6 months in domestic violences. Having social workers in the team has been great from their safeguarding backgrounds. Memory assessments, we've seen a big spike in memory assessments over the last few months. I think couples being stuck in the house together are starting to notice that deterioration in their memory. So the model in brief touched on it, but we were going for a GP-light model, and we were going to be using our GPs more as consultants supporting the wider MDT. We've recruited heavily with advanced nurse prescribers, mental health practitioners and home visiting teams to try and change the way in which we deliver primary care. We've been working with a company called Capacity who've supported us from a business point of view, and they've supported us to do this impact assessment. What we did was send out patient questionnaires to as many people as we can. We didn't get fantastic comeback, but some of the outcomes we'll go through now. So the patients who did access the emotional wellbeing team, their feedback was highly positive. You can say that they were really happy with the service that they experienced. We've worked with people, and it's important to say that we're ageless. We'll work from any age from 1 up to, I think the oldest we've had is 101 for a memory assessment. So we haven't got a criteria. We also absorb a lot for the surgery. We absorb sleeping problems, pain management, deprescribing. So we lot as a service, and the feedback from GP locums and stuff is that it's nice having an emotional wellbeing team in-house to support them as well. So some of the data that we collected, we collected the data from Betty Cadwallader, and our own systems in-house, the EMIS system. And the numbers were huge, really. So 171% increase in initial contacts. So they come to us, they don't come to the GPs. Anybody who calls up in crisis or needing anxiety support or sleep support will come to us in the first instance, and we will develop a management plan for that person. The reason why we've been able to have a lot more initial contacts, I'm not sure really. Yes, we're a bigger team, but we are limited by the amount of phone lines and stuff we've got anyway. But I think COVID has had an impact. We've seen a lot of anxiety, isolation problems coming through. Domestic violence has spiked, definitely. But also our colleagues, as they're working with individuals from a physical point of view, they'll identify that that person needs a medication review. So prior to the emotional wellbeing team, it was very difficult for general practice to work through. I think we had 3,000 individuals on antidepressants, and they were all overdue medication reviews. So we've had the extra capacity to be able to work through deprescribing and demedicalising a lot of individuals. I think that's why the initial 171%, that's where that comes from. But it's the second point that I'm most proud of, and I think this is where we come into our own, really, and we've created an additional 2,880 appointments. We follow everybody up. We would never start a medication, we would never start an intervention and then not follow that person up. We would never refer into SPOA and then not follow that person up. By doing that, it leads us on to the next slide, which is the SPOA referrals. So SPOA is single point of access allocation and assessment. It's the gatekeeping service for mental health services. It's where GPs, midwives, any professional can refer, the police can refer in, and then the SPOA will decide the most appropriate service. You can see before us, in the 6 months, April to October 19, there were 226 referrals made into single point of access. During emotional wellbeing team's intervention, we only had to refer 97. And the savings we've estimated to be £45,000, a direct fiscal saving of £45,000 to the NHS by that 130 less referrals that we made into SPOA. That's only for 6 months, so you can double that to £90,000 over 12 months, and we're only 1/8 of the Wrexham population. So off the top of my head, it's close to £350,000. If Wrexham adopted a model like we're practicing now, the potential savings to the NHS in Wrexham alone could be close to £350,000 by having these specialist practitioners at the first point of care. So we sent out questionnaires to our individuals, and again, you can see the feedback is highly positive. How happy did people feel pre and post? You can see for yourselves how satisfied were you with your life pre and post again, and how worthwhile did you feel the things were in your life at the time. And after emotional wellbeing intervention, people did feel better. So our outcomes in brief: 44% said that they had reduced anxiety following intervention. A third said their mental health and wellbeing had improved. 22% mentioned feeling more confident or reassured following our interventions, and 11% said they no longer felt suicidal. The question was put to them: if they hadn't accessed the emotional wellbeing team, where would they have been? 55% said that their mental health would have gotten worse. A third said that they expected that they would have taken their own lives, and 11% said that relationships would have broken down. So our impact, from them 700 extra initial appointments, we've taken 1,343 appointments away from what would have been your traditional GP. But we've created an additional 3,600 appointments through all our follow-ons, through all our deprescribing, through our medication managements, our interventions. And like I said earlier, that's estimated to be a direct fiscal saving of over £45,000 to the public purse in them 6 months. The patients reported 128% increase in their happiness, 126% in their life satisfaction, and nearly 300% in their sense of meaning. Now, this social impact valuation, I'm not going to lie, I'm not sure how that's been worked out. There was our partners' capacity. There's a big impact assessment report which is available online, and it explains how we've come to that figure. But it does look at quality of life. It looks at lost sickness days from employment and so on. But I can't go into depth with that today. I'm sorry. So our experience of the Bevan programme. It's a shame that COVID had hit, because the networking events down in Cardiff were fantastic. Being able to share our stories, being able to listen to other people's stories and projects was fantastic. The support Sean, Helen, Nick and Hannah have given myself has been great. You've made sure that we've kept to deadlines, which everybody needs. Without a deadline, I don't think I would have been here today presenting finished impact assessments. So thank you very much. And what would we like to do next from an emotional well-being point of view? Well, we've got things we need to do in-house ourselves. You know, we need to improve our links, we need to improve our skills, we need to upskill each other. I'm doing my prescribing module as we speak. One of our nurses is doing an advanced nurse practitioner module. Debbie is in the middle of undergoing a social work degree. So we're upskilling ourselves with a view of possible expansion. There's no reason why this model, it's a simple model, it provides a better quality service than what a GP can, because we're offering 30-minute appointments as opposed to 10. There's no reason why this can't be expanded across the board into clusters, into any GMS practice in the country. So it would be nice to be able to work with the Bevan again through the Adopt and Spread programme to look at possibly doing that. And why don't we look at bigger things, the Welsh Ambulance Service. My dad works for the ambulance. I know full well that so many of their call-outs are for people in mental health crisis, and the paramedics and technicians are not equipped to deal with that. Why don't we look at putting mental health practitioners on the front line, removing us from our ivory towers? I do feel as mental health nurses, we are very protected in secondary care and in acute services. I would like to see us more on the front line, dealing with crisis, alleviating crisis. So why don't we look at supporting the Welsh Ambulance Service moving forward? So that's my presentation. Thank you very much.